This is a Rattle and Hump Sports podcast for Tuesday, April the 8th, 2014. I'm Bryan Houston. I'm here with fitness expert Kelly Hitchcock. It is time for another version of the muscle and the mouth. And today we're going to be talking about CrossFit. You know, we go through these eras where we have certain exercise movements that people get very into. Back in the 70s, a lot of folks jumped all over aerobics and started doing aerobic dancing and things like that. And you've seen phases of this. So, Kelly, first of all, a lot of people now are involved in CrossFit. Explain exactly for those who don't know what it is, what CrossFit is.
CrossFit would be like a large circuit-type training class. I mean, that puts it kind of, I know, simplistically. But what it is it's a combination of movements. Usually those movements are associated with Olympic-style lifting, such as cleans and jerks. They also include a lot of plyometrics. They might also include running. So it's basically a combination of a lot of different movements. Sometimes they're termed as functional training, which I would argue that all training is functional. But when I say functional, meaning things that you might encounter in everyday life. They're moves to mimic things like that.
And I would think that it's pretty intense training.
Yeah, most times it is intense, and some of that is because maybe the clientele are new to the program. You know, any kind of program you do in the beginning is probably going to be intense.
Okay.
So yeah, it is intense, and then of course as you get more fit at it, as with any type of exercise program, the goal is to overload that program. So yeah, you're going to keep the intensity up all the time.
Okay, now there are good aspects to CrossFit and there are bad aspects to CrossFit. We do not want to offend or discourage those people who are involved in CrossFit, but at the same time, we want to make sure that we give all the information out there about what is safe about CrossFit, what may not be safe about CrossFit, because you want to have all the information when you're deciding whether you're going to try this or not, right?
Sure, and you know, I want CrossFit people to understand where I'm coming from too. Any program can be unsafe. So, and that's any kind of training. As a fitness professional, you should always seek out to find what your clientele's goals are, and then you want to prescribe a program that's beneficial for them to reach that goal in a safe and effective way.
All right, so let's first of all talk about the goal. If someone goes into a CrossFit class, what usually is the goal they have and what should be the goal?
Ooh, well, I can't speak for those people. I think that we all, when we start an exercise program, the goal is to get more fit.
Lose weight.
Yeah, right. Lose weight, be more aerobically fit, maybe be a little bit stronger. Those are all aspects that you can achieve in any type of exercise program. I think part of the draw to CrossFit is the group involvement. I mean, it's fun, it's competitive. There's a good social atmosphere that goes along with that. You meet new friends, and it makes it fun. I mean, it's kind of a group fun fitness program, which I think is very attractive to a lot of people.
And there's nothing wrong with that.
There's absolutely nothing wrong with that. I mean, you want to encourage people to do exercise programs that they'll continue to do. I think one of the main concerns is that you want to make sure that you're doing a program that you can continue to do. And, as we age, the tendons and the ligaments, our back, our knees are some areas that may suffer from chronic exercise. So you just want to make sure that you're doing a program that's very beneficial for long term rather than the immediate gratification of the moment. So I think that's one thing that we have to be concerned when we look at doing the type of movements that CrossFit uses.
Can you give me some examples of these movements?
Well, the only concern that I guess I have, which is a big concern, is, like I said, you're using a lot of Olympic lifting movements, or those are known as ballistic movements. Those are movements that require speed with weight. They're pretty jerky in their nature, and those are that's kind of a bad combination. Let's say if you're 30 years old and you haven't worked out since high school, that's something that you want to start off maybe slower And I do know that a lot of, and I hate to characterize all CrossFit gyms, or I'm generalizing basically, because I'm sure there are those that do focus a little bit more on proper form and technique. So I don't want to lump all CrossFit gyms into one specific group. But, when you have a group of, say, 15 to 20 people, and you have 1 to 2 instructors, and you're taking these ballistic movements, and you're competing, you're seeing how many you can do in a certain amount of time, there's certainly cause for concern anytime you do that type of movement with that type of speed, because when you look at let's say a snatch or a clean, these are movements, like I said, that Olympic lifters do, and they're usually performed anywhere from 1, maybe 4 repetitions. They're very controlled. It's people that have started doing this type of lifting usually from an early age, and they usually don't lift that way later in life. I mean, there's definitely usually a shift into more traditional style of training. So these are movements that require a lot of technique, and it's just hard to start someone out at an older age to learn these techniques without some type of injuries occurring.
Okay, now being an old person like I am, what are we talking about when you say older age? I mean, what age group are we talking about?
I hate to put an age limit on it. What I would say is if you haven't worked out since high school and you're 35 years old and you're considering doing one of these classes, I would say be very, very careful.
So you need to be at a more advanced fitness level to begin with if you're going to take part in a class like this safely.
Definitely. I mean, CrossFit is a very intense workout program. It's not for a beginner, and I think some have beginner classes, but it takes a while to get up to that advanced class. And I think one of the problems is that might happen is in those beginner classes or intermediate classes is there's that competitiveness to it. And a lot of times that competitiveness to it makes us do things that we wouldn't normally do. I mean, we're not consciously doing it, but it's just that drive that some of us may have that we may try to outdo what we're capable of doing.
Okay, and then what kind of injuries are we talking about that you've seen as a result of overdoing it in a CrossFit class?
Well, fortunately we work with some pain management guys here in town and some orthopedic guys. And I would say probably the number one issue that we see is lower back, lumbar area, bulging disc, ruptured disc. You can also, you have a lot of tendonitis problems in the elbows. Also, you can see some knee issues because you're doing a lot of plyometrics. That's where you're jumping up and down off of boxes, for repetitions. A lot of overuse injuries, a lot of shoulder issues, maybe rotator cuff problems. And I think that's enough. Torn muscles, pulled muscles, and that's why, if I was to make some recommendations, say if you came in here and you wanted to get, in better shape, it's one thing about the traditional style training that is a little bit better is it's more controlled. Your concentric, the positive phase of the movement is you're curling that up at a little bit quicker rate, but the eccentric, the negative lowering phase is done in a real slow and controlled manner. And that's a lot safer. That's not to say that you can't get hurt. But I will say that I've been training people for 30 years, and I really can't recall having any major injury in those 30 years. I mean, we're all going to develop a little tendonitis here and there, but, never as far as a ruptured disc or anything like that.
The other thing that strikes me about any kind of a workout like this, that with the level of intensity that this has, is the burnout factor. It does strike me as being, and again, I've never done CrossFit because I'm not physically able to. I know I wouldn't survive in that kind of class, and I admire people that are strong enough to do it. But it looks to me like something that would be great for a while, but it's not something that I could see you doing for years down the line. Am I wrong in making that judgment?
Well, again, I think as long as our workout programs are geared toward our goals, and the adaptation of CrossFit pretty much is muscular endurance. Mm-hmm. So I could see if you're let's say a fireman combat challenge type person. Maybe a police department, SWAT team, something that you need to be pretty good at a lot of different things. That could come in handy.
But you just said something there. That's competitive training. That is training for competition. It's not just your average, I want to get in better shape kind of training.
Right. No, yeah. I mean, it's for competitive people. It's for people that maybe their job skills require them to have a certain fitness level. As far as the average individual, I mean, of course, if you're fit, you can do it. Mm-hmm. But, you just need to be aware of the risk that you're taking and be aware of the competitive nature of it. Make sure that you stay within your limitations. Don't try to do something that, you see someone else doing. And as long as you're able to do that, then, yeah, it probably could be done safely. I just know from, like I said, again, the doctors and some of the pain management guys, some of the concerns that I've had is that we've actually had a lady that came in that went to look at a class, and she was encouraged to take the class fresh off the street, and she ruptured her lower disc and had to go straight into surgery. And again, that may be the extreme. I'm not sure, but this lady hadn't even signed a waiver. So just be educated about what you're about to get into. Be careful. I mean, I know a lot of people, their friends have told them about it, and that's why they wanted to try it out. And again, that's okay, but just educate yourself about it. If you have bad knees or if you have any other problems going into it, realize that that's probably going to make those issues worse, because you need to be more in a controlled environment, basically, and you probably need to have more of a one-on-one type trainer to get you started, and then you could go on your own. But knowing the basics and knowing this proper form, I think, is so important.
It's funny, every time you read about starting a fitness program, one of the first things they say is you need to consult your doctor first, and everybody just kind of blows that off. But it sounds like in this case it's probably a wise thing to do if you're considering getting into something like CrossFit or something that's as intense as that is. It probably is a good idea to check with a doctor and make sure that you're in the right physical frame to be able to do that.
Oh, definitely. I mean, the first thing that we do is when people come in, we have them sign a fitness waiver. And if there's anything on there that may cause concern, we do recommend that they do that before we start training them. That could be, if you're taking any kind of a high blood pressure medication, if you're taking anti-inflammatories for maybe some joint issues, if you're diabetic. I mean, there's a lot of things that you need to consider before someone starts a workout. Heart palpitations, if you're on beta blockers. These are all things that need to be talked about so that we understand and help to better prescribe you a workout program and a nutritional program. Those things go hand in hand. So I think ultimately, what our goal and what our role should be is not only to increase your level of fitness, but do it in the safest form we can.
Okay, so the moral of the story is check it out, be careful, know what you are capable of doing before you get into something where you may overtax yourself, I guess, to the point of risking injury.
Yes, I mean, someone on the street going into a CrossFit class and starting out at let's just say their regular class, would be like me going to meeting a running group and going out and run a 10K. I'm probably fit enough to do it, but the repercussions I would have for the next 2 to 3 days would probably would not be favorable for me to do. It wouldn't be beneficial for me health-wise. It would be less beneficial and probably create problems for me. So, I, of course, would need to start off slow and get fit before I tried doing something like that.
All right, and one other question, because I have to ask this because, of course, I'm selfish and self-centered, and all I really care about is me. But, again, I'm in that plus 55 group. So how realistic is it for somebody like me to get into something like a CrossFit class at my age? You're being real kind right now.
Well, I mean, I wouldn't, I would have to ask you again, I'm sorry, but I'd have to ask, what is your goal? And as a 50-year-old person, I would think that there's better ways to achieve your health and your goals rather than doing a class like that. Now, I'm going to admit that there's some things about my class that may not help, or my workout programs that may not help you reach your goals. Mm-hmm. And I think that it's important that CrossFit also inform people that their program might not be the best. Okay. I mean, training has got to be very specific to your goals. And I really don't see a 50-year-old flipping a tractor tire. Unless you work on a farm. then that might be one thing that we could do for you. But there's just not a lot of 50-year-olds that flip big tractor tires that are 200 pounds.
And thank God for that too.
And it's been a while since I've had to jump up 36 inches high onto something and then jump back down and have 3 to 4 times my body weight applied to my knees. So these are just things that we need to consider. I know that it's fun, and I know that one thing about what we offer may be redundant for some people, but it's very functional. And what it does is long term, you're going to be able to do things that most 50-year-olds cannot do. And you'll be able to get out and throw the ball with your kids or go for a bike ride, or because we're not only training strength, but we're also training endurance and getting some aerobic activity in with that too. So I think it's just it's very, very goal oriented. And let me say that when you're on a program, any program, just as CrossFit, to get better, you have to overload. So you have to keep pushing it and pushing it and pushing it. And anything that where you're doing power cleans and snatches and flipping tires, I mean, that if you keep pushing it, it's kind of just a matter of time before there's going to be some injuries. So, I want people to think about that too. I'm not saying it's bad. I think that it has its place. I just think that we need to ask ourselves where we see ourselves in 20 years, because you're right. I mean, is this something that you see yourself doing as a 60-year-old?
I can't see myself doing it now.
Well, me neither. But, if that is something you do, I just say, research it and, be safe and realize that you're going to have to govern yourself a little bit there, because, if you're a 15-to-2 ratio as far as students and trainers, then you're going to have to, take your health into your own hands to some degree.
Very good. If people want more information about this or anything else to do with health and fitness training and so forth, how can they get in touch with you?
You can email me at khfitness@aol.com. You can go to our KH Fitness Facebook page, which is one word, KH Fitness. You could also call here if you would like, if you have any more questions. It's 903-581-0404.
Very good. And, of course, we'll be having more of these podcasts on Rattle and Hump Sports. And so we appreciate your time, Kelly, as always.
And thank you, Bryan.
Thank you very much. Kelly Hitchcock, the muscle and the mouth. I'm Bryan Houston. Thanks very much for listening, and we'll talk to you next time.